Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's April 2023 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. The Editor's Choice this month is an original article entitled Cardiovascular Risk and Diseases in Patients with and Without Leptin-Melanocortin Pathway Variants. It is authored by Dr. Lizeth Cifuentes and colleagues from Mayo Clinic in Rochester, Minnesota, and the Mayo Clinic Health System in La Crosse, Wisconsin. Obesity, a growing national and global disease, is a major risk factor for type 2 diabetes, hypertension, and cardiovascular diseases. Obesity, as recently discussed by Luz and Yao, may be broadly classified either as one of 2 types. First, there is the polygenic obesity, which is common and characterized by variants in multiple genes, with each variant having a relatively small effect, low penetrance, and robust environmental influence. Second, there is monogenic obesity, which is early in onset, severe, rare, and characterized by single gene mutation, robust genetic effect, high penetrance, and no environmental impact. Salient considerations in the pathogenesis of both forms of obesity involve abnormalities in the neuroendocrine networks that regulate energy balance and body weight, especially the leptin-melanocortin pathway. Leptin is an adipokine that signals to neurons in the hypothalamus bearing the leptin receptor, and such neurons include, among others, pro-opiomelanocortin expressing neurons. This elicits downstream signaling via melanocortin-4 receptor on neurons in the paraventricular nucleus, which leads to decreased food intake. This complex neuronal circuitry is of immense significance. Its activation leads to far-ranging biologic effects, while genetic derangements in key participants can cause disease. Importantly, agonists of the melanocortin-4 receptor are the basis for novel therapies for obesity. Cifuentes et al. Examined whether cardiovascular risk factors and diseases exist in obese patients with and without genetic variants in the leptin-melanocortin pathway. The patients in this study were participants in the Mayo Clinic Biobank and included 168 carriers and 2,039 non-carriers. Excluded from analysis were homozygous and compound heterozygous carriers and any patient who had undergone bariatric surgery. The data demonstrate that carriers, as compared with non-carriers, exhibited a significantly higher prevalence of hypertension and certain cardiovascular risk factors, but comparable adjusted odds for cardiovascular diseases. The significantly higher prevalence of hypertension in carriers persisted after adjustments for BMI, sex, age, and relevant cardiovascular risk factors. The significance of these findings are multiple. First, they support the view that abnormalities in the leptin-melanocortin pathway may contribute to hypertension. For example, preclinical studies demonstrate that the administration of leptin causes hypertension, a finding supported by clinical observations and an effect mediated, at least in part, by sympathetic nerve activity. Indeed, Cifuentes et al. Suggest that increased sympathetic nerve activity may underlie the observed increased prevalence of hypertension in carriers. Second, these findings demonstrate the utility of a precision medicine approach in understanding diseases in general, and in obese patients who are carriers of heterogeneous genetic variants in the leptin-melanocortin pathway. These findings promote an awareness of hypertension. Finally, they demonstrate how rigorously collected and curated biobank data can provide novel insights relevant to the pathogenesis of disease and the management of such diseases. Our first highlight article this month is an original article entitled artificial intelligence augmented electrocardiogram in determining sex, correlation with sex hormone levels. It is authored by Dr. Joanne Nath and colleagues from Mayo Clinic in Rochester, Minnesota. The artificial intelligence AI-enabled ECG is truly a marvelous example of how AI can expand and refine the diagnostic potential of a given test. In this case, the ECG, an inexpensive, widely used, non-invasive, facile, more than a century-old test, which has remained essentially unchanged for so many decades since its introduction. The present study of Nath et al. Questioned whether such enhanced discernment of the AI ECG allows it to serve as a biomarker for the sex hormone profile. This study builds upon and advances prior studies by this pioneering group of investigators, which demonstrated that the AI ECG can accurately identify self-reported sex. Nath et al. Retrospectively analyzed consecutive patients who had measurements of plasma total testosterone or estradiol concentrations made between 2000 and 2020, and ECGs performed within 6 months of these determinations. The data demonstrate that total testosterone concentrations exhibited moderate positive correlation with AI ECG male sex probability, in particular in adults less than 50 years old. For either sex, the AI ECG male probability exhibited a dose response with total testosterone and estradiol concentrations, and male and female patients with discordant AI ECG sex probability had significantly different total testosterone or estradiol levels as compared those with concordant sex probability. Based on these findings and relevant published preclinical studies, Nath et al. Suggests that sex hormone levels themselves mediate the sex-dependent signals detected by the AI ECG. Moreover, the age-dependent diminution in sex hormone levels may explain why the strength of the association between AI ECG sex probability and sex hormone levels is generally greater for patients less than 50 years old. The authors suggest that the AI ECG may be a biomarker in such conditions as detecting males with low testosterone levels, monitoring patients with prostate cancer undergoing androgen deprivation therapy, and other patient populations undergoing hormonal therapy, and following the decline in estrogens that occurs after menopause or conditions such as primary ovarian failure. Who would have ever thought that the ECG would provide a window into the hormonal milieu that largely underpins male and female sex? However, as shown by Nath et al., such biomarker capability of the ECG can become a reality through the power, versatility, and innovative application of artificial intelligence. Our second highlight article this month is an original article entitled Association of Initial and Longitudinal Changes in C-reactive Protein with the Risk of Cardiovascular Disease, Cancer, and Mortality. It is authored by Dr. Naveen Suthaha from the University Medical Center Groningen, University of Groningen in the Netherlands, and colleagues from other departments in the University of Groningen and institutions in the United States. C-reactive protein, an acute phase protein produced by the liver when stimulated by cytokines such as interleukin-6, is clinically used as an index for systemic inflammation. Based largely on single C-reactive protein measurements, elevated levels of C-reactive protein are associated with cardiovascular diseases and cancer. Suthaha et al. Questioned whether serial measurements of C-reactive protein would improve the prognostic value of C-reactive protein for such diseases. These authors examined two prospective observational community-based cohort studies, namely the Framingham Heart Study and the Prevention of Renal and Vascular End-Stage Disease Study. From these cohort studies, more than 9,000 participants had C-reactive protein measurements at two separate time points. In this study, cardiovascular diseases encompassed myocardial infarction, coronary artery disease, heart failure, peripheral vascular disease, and cerebrovascular disease. Cancer included all malignancies other than non-melanoma skin cancer. These findings demonstrate that the initial C-reactive protein levels and increments in C-reactive protein with time were associated with incident cardiovascular diseases, cancer, and all-cause mortality. Additionally, the data also demonstrate that greater increments in C-reactive protein associated with age, female sex, smoking, BMI, and serum cholesterol. The authors make the following important points in discussing their findings. First, sequential changes in C-reactive protein as compared with a single C-reactive protein measurement impart additional information pertaining to the risk of cardiovascular diseases, cancer, and mortality. Second, cardiovascular diseases and cancer share certain traditional risk factors, but the residual risk for these diseases persists beyond these risk factors. C-reactive protein may contribute, at least in part, to such residual risk. Third, increased inflammation, as indicated by higher levels of C-reactive protein, promotes senescence, which itself predisposes to cardiovascular diseases and cancer. Fourth, their data support the growing evidence that anti-inflammatory therapies may reduce the risk of cardiovascular diseases and cancer. Finally, this timely study of Suthartha et al. Is a telling example how serial analyses utilizing prospective cohort studies can glean important insights regarding diseases and their management. You can access these highlights and editor's choice articles free of charge during the entire month of April. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find links to our social media by clicking the buttons at the bottom of the home page, or to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights and our MCP 60 seconds video article synopses. Our website also includes our Mayo Clinic Proceedings issue summary and Author Insight podcast recordings, which are available from our website on our home page as well as through iTunes. You could also find our online-only features and many news stories posted in the News from the Editor carousel on our website homepage that are based on articles published in Mayo Clinic Proceedings. And finally, you'll see other free content as well as articles published online in press. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.